This word, logotherapy, logos just means meaning. And in fact, logotherapy could be defined as a psychotherapeutic approach which specifically focuses on meaning and regards man as a being who is in search for meaning in the sense of his or her most fundamental motivational force.
So health professionals who use logotherapy would assist clients to find meaning in their lives?
In a way, logotherapy also has developed certain psychotherapeutic techniques in a rather traditional sense. That is to say, strategies against phobic or obsessive compulsive conditions, or techniques to overcome sexual neurotic conditions. But the specifically logotherapeutic approaches are marked by the focus on meaning and or on the lack of meaning, as it is has become so topical in the present situation, psychological situation, not only of within certain populations, but also regarding mankind as a whole.
Theory was the will to pleasure, and Adler's was the will to power, and logotherapy, the third school, is the will to meaning. Would you explain that?
Yes, first let me say that, of course, this is an oversimplification for the sake of college students who have to learn something and to remember something they have learned. But by and large it is correct, because in fact Freud came up with the notion of the pleasure principle as the basic motivation operant in man. And if any adherent of Freudian psychoanalysis would argue that after all the pleasure principle is not the only principle, but there is also the reality principle, I would have to retort that the reality principle, according to Freud's explicit statements, is nothing but an extension of the pleasure principle, inasmuch as it also leads man to finding, to seeking and finding, gaining pleasure, but in a delayed way. Pleasure is just postponed for the sake of being more securely obtained. But actually the pleasure principle itself serves another purpose, inasmuch as it is to restore or maintain the inner equilibrium, a state, an inner condition without tensions. The tensions are removed by satisfying drives and instincts and setting up compromises between the ego, superego, and society. In contrast to the superego. The superego is just reflecting or mirroring the perceptions you obtain throughout your education, your youth, from the parents, from your peers, from your comrades, from society. But conscience is something different. Conscience is not dictated by society, but by yourself, your own, your personal conscience. Conscience is a phenomenon profoundly personalized. You have to listen to your conscience, carefully to listen to it, and should go on and carry out what conscience commands you to do. And this is important, particularly today, where people in a competitive society such as yours here in the United States particularly are out to compete with others rather than with themselves, and to be successful. They are striving, they are hunting, they are chasing happiness and success on the other side. And this exerts a certain pressure, particularly on young people, and is deforming, degenerating, distorting the normal, the basic human attitude to find a meaning and to carry out a meaning. If you allow me a short digression, I once answered a pertinent question from the students at Stanford University several years ago about a book of mine, Man's Search for Meaning. They told me, Dr. Frankl, this book has seen only in this country 73 printings and 2.5 million copies have been sold. And how do you feel about it? And I told them, it's interesting. The only remarkable thing in this context seems to me to be the fact that this very book, among 27 books that I've authored, this one book that had become such a success was written with the 100% conviction that it never could build up any reputation for me of mine as an author, because I had decided to publish this book anonymously. So I knew while I was writing it up to the last word, it will not do anything for myself, but I did it, you won't believe it, I did it while contemplating that if someone lies in a sanatorium, in a bed, knowing that is going to die within a short period, suffering from a fatal disease, say an inoperable cancer, actually nothing can be done about this fatal situation. He's approaching death. And then, in such a desperate situation, he takes up that book of an unknown author. And then he might think, if this guy over there in Auschwitz did not lose the conviction that up to the last breath, as Jerry Long formerly expressed it so beautifully, up to the last breath, under any conditions, even the worst ones, the most miserable ones, life retains a meaning up to its last moment, up to our last breath. And this man, this unknown man, this anonymous, has shown this. Then there must be something to it. And I wonder if not myself also could change my attitude towards something that per se in itself is unchangeable. And thanks to heaven, I lived up to an age of 80 where evermore I could see that, in fact, it's exactly what happened around the world, you see, in hospitals.
Yes.
I become letters from nurses, from patients, and so forth, from the relatives of patients. And this, in fact, or just think of Jerry Long, or those personalities.
Therapy with patients, spinal cord injured patients.
I don't wish to say this in order to aggrandize the book or even let the author, but just to show what a book, any book that has been written earnestly for others can do as a multiplier of something. See? And this was what I wound up with when I replied to the respective questions of the Stanford students. I said, I wrote this book, incidentally, within 9 successive days, the whole book, in 1945. And I wrote this book imagining that a man in despair or a woman in despair might take up reading it. For them, I did so. And there's a proof that I did so, because the first edition in the original German did not carry the name of the author on the cover at all. Mm-hmm. And precisely this book was so successful and told him, do not hunt for success. Do not care for success. Just do what your conscience commands you to do. And if you are responsible human beings, you will follow and obey your conscience. In the long run, then, success will come to you precisely because you have not cared for it. Precisely this was the reason. By just doing a thing for the cause's sake or for others' sake, but not for your own sake. And then success comes by itself, comes automatically. And this is the real success. But this is evidence in this case. And I say it just because it is, in the widest sense of the word, an empirical evidence, and young students are again and again, I could notice it, impressed by this fact. And one or the other might follow the example of an anonymous order.
And that is the self-transcendence concept.
Exactly. You become yourself. You become a truly human being. You actualize yourself precisely to the amount to which you don't concentrate on self-actualization, but you give yourself, you forget yourself, you give yourself to the task at hand, to the challenge of a situation, listening to what a situation means to you. Meaning is what is meant by a given situation. And you have to address yourself and giving yourself. This is what is afforded. And it's like you might know from one or the other of my books, I used to compare this situation with the function of the eye. The possible zoom under the heading of talking, also asking questions.
Yes.
See? Because the essence of the Socratic dialogue lies in the fact that by asking questions, we elicit something from the patient he had known all along, but he was no longer conscious of.
Thank you, Dr. Frankl. At this time, let's stop and take a look at a clip we made with Jerry Long earlier. Good morning, Jerry. How are you today?
Good morning, Dr. Stark. I'm fine.
Good. We're glad to have you with us today. Jerry, you have an injury, your spinal cord at level C4. Is that correct?
That's correct, yes.
Could you tell us a little bit about what your life was like before the injury?
Well, prior to the injury, I was a 6 foot tall, 160-pound, very athletically inclined young man. I worked outdoors on a horse ranch. I played baseball, and therefore my primary source of meaning was physical prowess, and I took great pride in my work, and I took great pride in playing baseball. So that's how I derived meaning prior to breaking my neck.
And you were 17 years old when the injury occurred.
Yes. I was 17 years old during the summer between my junior and senior year of high school.
And now you are a young man, 25 years old, in the doctoral program, the University of Houston, studying psychology. Can you tell us a little bit about what transpired and why your goals changed?
Well, even prior to the injury, I had the mental capacity and the intellectual ability to do things other than physical work, but I did not tap into that. And when I broke my neck, I realized that to have a productive life and to have a meaningful life, I would have to depend upon something other than my physical being because it was no longer there. I decided that I wouldn't let breaking my neck stop me from doing what I wanted to do in life. And I realized that education was a big part of this. So as I began my college education, I was soon leaning towards psychology because of the interest that developed in some introductory courses. And I pursued that path and got a bachelor's degree in psychology and entered a doctoral program in clinical psychology.
And Dr. Frankl is the man whose ideas helped to shape your goals. Is that correct?
In a very critical way, yes. The very first introduction to psychology course that I took, one of the books I read was Dr. Frankl's most widely circulated Man's Search for Meaning. Immediately upon completing it, I identified with some of the things that you wrote about Dr. Frankl in the book. And so I wrote him a letter. And much to my amazement, he wrote me back. Very, very applauding and very, very meaningful letter. And therein began a relationship and a correspondence and a professional respect which has continued and mushroomed into today's events.
Dr. Frankl, would you comment on how logotherapy is helpful to people like Jerry?
His example, the example that he has set up by his being, by his living, by the way in which he coped with his suffering and with his handicap, speaks for itself in a way. But if you force me to put it into logotherapeutic terminology, I could just add that he has set an example of the incredible amount to which a human being is capable to carry out, to live what we are used to calling the defiant power of the human spirit. The human spirit is capable to defy both outer and inner circumstances to an unbelievable degree.
Well, he certainly is an example of that. I know, Dr. Frankl, that you have written that there are 3 ways to find meaning, one being in adopting an attitude toward a fate which cannot be changed. And in Jerry's case, it seems to me that that's what logotherapy has done for you. You have a permanent disability, a severe disability. There's nothing much you can do about that, but what you do have control over is your attitude. Could you tell us how logotherapy helped to shape your attitude?
I think that it's important to remember my attitude adoption and the logotherapy that I employed initially was without any knowledge of logotherapy. I had not read any books and I had no acquaintance with it, but intuitively I modified my attitude toward the situation. In one particular line that Dr. Frankl quotes fairly often, I broke my neck, it didn't break me. I had a physical constraint that I had to deal with over which I could not change. I had no ability to suddenly walk again. However, I did have the ability to choose to live and at least attempt a meaningful life in spite of that physical disability.
I think that substantiates your theory that within the human being is this innate searching for meaning. And it sounds like that's what you were doing, Jerry. And then when you read Dr. Frankl's work, it all fit together. This was exactly how you had been thinking. Did you have that feeling?
It began to fit together. And as I've written, when I read his book, I was overcome with a sense of deja vu.
Mm-hmm.
Because many times, he spoke of reactions and the way he felt and the way he interpreted his experiences in the concentration camps. And repeatedly were the times when I identified personally, I felt the exact same way when I lay in that hospital bed as he did when he was in that concentration camp.
It's also a compliment, what Jerry says, a compliment for logotherapy in a strange way, inasmuch as usually each one who comes up with a so-called new therapeutic or other scientific approach prides himself to offer something new, as I said right before. Whereas we are proud to just dig out, to just making people more aware, more conscious of something that has been within themselves, built in, as it were, all along. The wisdom of the heart, the sapientia cordis, that it is called, even referred to in the Psalms. Man, due to, forgive my shifting the terminology from the Psalms to logotherapy, what I'm used to calling the pre-reflective ontological self-understanding is just that the fact that man knows all along intuitively, as he put it, Jerry put it, intuitively, what life is all about. that life is a chain of unique situations implying unique potentialities to be actualized in a meaningful way. So the possibilities to invest meaning in our lives, or for that matter in each single life situation, is virtually infinite. Because as you were hinting to before, right before, there are various ways or avenues or leading up to meaning fulfillment. And if one avenue is closed, then you have still others. And it's up to the intuition of a really alert spirit as that of Jerry's to find out, if I cannot do that, he said, physically,
Yes.
over against mentally or spiritually or existentially for that matter. If I cannot use this avenue, I have to turn to another one. There are always possibilities and always alternatives. And he made use of this fact on the grounds of his immense intuitive capacity. And that we are just verbalizing in logotherapy the more or less unconscious, or better to say implicit wisdom of the man in the street. This is a compliment. This makes us proud. I wonder if
So it's calling forth the potential.
Pardon me?
Calling forth the potential that is within the human being.
Awareness of the potentials inherent as potentialities waiting to become actualities.
Right. I think your quote in Man's Search for Meaning is that we should not ask what we can expect from life, but rather what life expects from us. And
right. This is a Copernican switch, turning the greatest question on the lips or in the hearts of any human being, albeit more often than not on an unconscious level, turning this into the reverse. Actually, there is implied the fact that actually it's not up to us to ask the question, what is the meaning of life, but upon closer scrutiny, we might become aware in the final analysis that we are those who are asked, that life is asking questions to us. Questions we can answer, have to answer, but can answer only not by verbal replies, but by action, by doing something. Each situation confronting us implies a question. But this question can only be answered by our deeds, by our acting, by our, not to say our behavior, and if need be, if the situation necessitates to shoulder it, because we cannot do anything about it, for instance, a more or less permanent handicap, in such a case, what we can change is ourselves. Changing in the sense of rising above the situation, growing beyond ourselves.
Right. Jerry, I'm sure that you've enjoyed studying this. And since your injury, I would imagine that it makes a lot more sense to you. What do you plan to do after you get your doctorate in psychology?
It makes a lot more sense to me now because not only have I experienced it intuitively as a patient, but now as a doctoral student, I can see the implications that it holds for me as a health service professional to be. And once I obtain the PhD, I plan to continue counseling, teaching, and writing articles.